Hello, I am doing my presentation on maternal health and substance use disorder. To start off this presentation, I decided to do a little bit of a background on opioids, which is going to be something that I'm going to be focusing a lot during this presentation. So opioids were originally introduced in the late 1990s, and it is a drug that was introduced to the population as a prescription most of the time. So during the 1990s, the reason why it got so large was because that's when people started to get it prescribed to them, because it was seen at the time as a, miracle drug, and a lot of the doctors believed that it was non-addictive. And for that reason, there became a very widespread misuse of both the prescription version of it and the non-prescriptions. So these non-prescription opioids were often found on the streets, and the prescription opioids were kind of seen as something different from a dangerous drug. It was very much marketed as a very safe medication for people to use. Some of the most commonly prescribed opioids would be hydrocodone, fentanyl, codeine, oxycodone, methadone, and morphine. So all these big drugs are very well-known names because in the field of opioids and pain management, there aren't very many effective pain-killing drugs. Unfortunately, in America, after the introduction of opioids, it became a very large issue with all Americans from all different types of backgrounds and socioeconomic statuses, and even it didn't matter where the person lived. These opioid crises were affecting all communities. Because people thought that the drugs were safe to use when the drugs were first introduced to populations and patients, there weren't really that many studies that were done to determine the side effects and the harmful effects that these drugs might have on the human body. For that reason, these drugs became very harmful, and a lot of people became addicted to them, and because of that, America has one of the highest amounts of opioid abuse. For this reason, in 2017, the Health and Human Services, also known as HHS, declared a public health emergency and announced a 5-point strategy to combat this issue. So some of the consequences of the opioid epidemic are an increase in opioid misuse and related overdoses. So there have been a very large amount of people, like I said before, of different backgrounds. It doesn't really matter who have had these overdoses, and there is a large number of deaths attributed to the misuse of this drug. Another consequence would be the rising number of newborns experience withdrawal syndrome. So due to these two large consequences, HHS as well as Medicaid have kind of tried to reevaluate where they stand with it and how they can help the public and ensure that everyone is being safe and healthy. Along with this slide, I also incorporated this graphic that has, it's titled The Opioid Epidemic by Numbers, and it has some interesting facts about the opioid epidemic and the abuse of opioids. And it's just very shocking to see how many people it is affecting and how many lives are being lost every day to this epidemic. So for my policy meeting, I was able to view this meeting on C-SPAN. So right now we're going to start to get into the problem and kind of like what they were talking about during the meeting. So a large number of new mothers and children are experiencing issues from the opioid abuse. Like I said before in the previous slide, one of the largest consequences of this epidemic is the rising number of newborns experiencing withdrawal syndromes. So that also is very relevant to the mothers and other children, not just newborns. So something that has been talked about is actually extending Medicaid coverage for an additional year for those who are being affected. So this is aimed at mothers who have just, given birth and that have the substance use disorder, and due to the long-term treatments for the substance abuse, it is thought that it would be more beneficial and help with the recovery of the individual to extend the Medicaid coverage for that additional year. One of the large issues that might come along with that is that Medicaid is actually different depending on each state. It is kind of crafted to aid with whatever the community might be suffering from. And so it's very kind of flexible to kind of align with the needs of the community. So that is one issue that might come up that I know they expressed some concerns over during the policy meeting. One of the concerns also was that a lot of people are first prescribed opioids from a surgery. So this drug, it is very easy to kind of get into the everyday person's life. A lot of people have these surgeries that might require a lot of medication, a lot of pain management. So a lot of the individuals that are prescribed these drugs oftentimes are in their late 30s, early 40s, or even a little bit older than that, but kind of those healthy adults who have just experienced a very painful and unpleasant surgery. So this is all just aimed for that pain management. But unfortunately, they are very addictive. And for that reason, a lot of people are prescribed these opioids, are supposed to be taking them for 3 to 6 months. But during those 3 to 6 months, the individual can become very addicted to the substance. And after that, it is more likely that they are going to develop an addiction to these opioids that they were prescribed to their doctor from. A lot of people think that just because they're getting medication from a doctor that everything is safe, but this is kind of the drug that can kind of sneak up on people and very surprise people that do not think that they could ever be addicted to any type of substance. Another point that they talked about during the meeting was that the women who enter a substance use treatment program funded by Medicaid usually have a wide range of behavioral and medical, psychological issues. So they are not only going through this very real substance use issue, but also all these other underlying issues that kind of do not help, but also just hinder their progression and treatment. Along with this slide, I also incorporated this visual of just kind of the differences in the opioid use disorder that has kind of been happening over the past 15 or so years. So it is believed from 1999 to 2014, there has been a large increase of almost 4 times. So the numbers quadrupled from the women that were suffering from this disorder to 2014. The graphic also shows some of the unfortunate results that can happen when a expecting mother uses these opioids. So that can be the death of the mother, so the maternal death, preterm birth, stillbirth, and then also the neonatal abstinence syndrome. So currently Medicaid is trying to realign their actions with their pillars, so they are aiming to be a little bit more flexible with their program. Hence why they are kind of reevaluating things and see if they can extend Medicaid coverage to these women who are being affected. Something else that the HHS is trying to look into is a task force to fight drugs and the cartels that might be providing our communities with these opioids. Soon after the news came out in the 1990s that opioids were actually very highly addictive and people were abusing their prescription drugs, it became a lot stricter to kind of get prescribed these drugs, and more parameters were set out to protect communities. And for that reason, a lot of people are turning to not only prescription drugs, but a lot of times the non-prescribed drugs. And for that reason, they're looking to these drug cartels and trying to kind of get a handle on that to control and regulate what exactly is going into our communities. Another topic that was discussed at the meeting was more research going into the underlying causes of these opioid addictions. A lot of people do not know exactly what makes things so addictive, and especially when trying to manufacture these prescription drugs for these individuals, a lot of companies are trying to look into different ways to manufacture drugs that are not going to be as addictive. But it is very tricky because a lot of these drugs are made from the same type of chemical shape. So since they all have similar shapes, they all kind of react with the brain in similar ways. For that reason, a lot of these opioids are all very addictive because they all kind of interact with the brain in similar ways. In the meantime, one of the biggest things that is being looked at is expanding that Medicaid coverage for an extra year for those women who just gave birth and that are suffering from the substance use disorder. But yeah, like I said before, due to these long-term treatments for this substance use disorder, it is very important to kind of aid these women and really help them try and get past these struggles that they're overcoming. Another topic that really is being looked into a lot is also ensuring that women are healthy way before they give birth to their child. We want to make sure that women are, really, that they don't run into these issues. By investing more in women health, the hope is that we can kind of catch things way upstream before they kind of get downstream and kind of get away from us. Overall, having the opportunity to kind of listen in on this policy meeting was very interesting and beneficial, I believe. And one thing that I think could be done a little bit better maybe next time in a similar policy meeting is maybe giving a little bit more background into the topic that is being discussed. I know that I kind of did a little bit more research after kind of learning a little bit more about what they were talking about, and I think it would have been beneficial if they could have included a little bit of background information on opioids, the opioid epidemic that's happening across the nation, as well as the relation to women. Something that I did find very interesting, though, was that it is a huge issue that not many people know about. I did not know that this was an issue affecting so many Americans, and I think it's a very interesting issue and something that can, really affect so many people from different walks of life. And I think that's why it's an important topic to talk about to all types of communities, because you don't really know who this can be affecting. And then I also think that more information should be provided to people that are being prescribed these drugs and kind of make people more aware of the risks and the issues. That kind of ties into the community cornerstone. And it's really important to kind of be mindful of the community and ensure that the community is strong and healthy and we can kind of rely on each other. So I think that education is very, very important in these topics and kind of letting people aware of these large issues that are affecting so many people. And it's kind of like the quiet epidemic, I believe. It's something that is very, relevant to everybody, but something that not many people talk about. And I feel like you can't always tell that someone might be suffering from this substance use disorder. So, in conclusion, a lot of attention and resources are being invested from HHS as well as Medicaid into women's health and this opioid epidemic. Opioids abuse is a very important issue that doesn't really get that much attention, but the research that is being done currently can help better the national health and also just give us all a better understanding of what it is that might make things a little bit more addictive than others, and maybe possibly find a drug that can substantially reduce people's pain, but then also take away that risk factor in it all. Currently, there is a large number of new mothers and children to experiencing issues from opioid abuse. And this is something that is from all states, and it doesn't really just affect one type of population, but it affects all populations. And it is very important that policymakers kind of reevaluate Medicaid in their state and really reconsider maybe extending Medicaid that extra year to help these people get back on their feet and really help them get past this very serious issue that they're combating. Okay, so reflecting on this project, it was very interesting to hear exactly what's being done regarding these large issues and kind of seeing how policymakers talk about different topics and how they are all kind of working on different aspects of the same issues. And it's very important that they kind of really reach out to different resources, reach out to scientists, reach out to people working with the patient, so like the physicians. And I think it's very important that they create that holistic view of issues. And it was very apparent in the presentation that I listened to, that is exactly what's being done. So I think that's really cool to kind of see how they are so knowledgeable about this one specific topic, but it just like, it was like almost falling down like a rabbit hole of like information that I just was not really even aware was like an issue. Also, just listening to the reasoning behind the work that they're currently doing was also super interesting to kind of see how they are changing different policies, and how even though that Medicaid might change from state to state, they're really trying to really make these issues large enough that all states have to make some alterations to their Medicaid to help these people that are fighting this. I also really enjoyed kind of just watching the presenter and everyone else kind of just interact with each other, because it was almost like they were learning so much from each other and the information that they're bringing to the table and presenting to each other. So I think that was really cool to see how they were really working together towards that common goal. And that is the conclusion of my presentation.